our last resident talk for today will be Dr. Sean Mooney with facial nerve reanimation in a rat, a feasibility study.
Okay, all right. Good afternoon, everybody. Wrapping it up today. First, I just want to say thanks to Dr. Colmar for allowing me to be in his lab for like 9 years now and like putting up with me. My study is facial nerve reanimation in a rat. It's a feasibility study, and there's been a lot of people that have contributed to this over the years. I'm just one person that's involved in this. And so to get started, facial nerve injury in head and neck surgery is a really big problem, right? It can impact patients in so many different ways: quality of life, just ability to express themselves, who they think of themselves as a person. And the issue is our treatments don't always really fix the problem. They have varying outcomes in terms of quality and difficulty to approach, and I think that it's a really big issue that a lot of these patients have. And right now, there is a lot of studies that have been conducted to see if they can try and restore facial movement in animals, but none exist in which there is a neurarpy and then stimulation and recording of movement afterwards. It's maybe a couple, but they're really, really old. So we're kind of trying to advance that into the future now. So we propose an innovative approach in a rat model with facial nerve injury. Our hypothesis is that a 12-to-7 neurarpy can restore symmetric facial movement in a rat. And the way we do this is it's kind of a two-step project. The first is we do a neurarpy of 12-to-7 after an acute injury to the nerve, and then we allow it to heal. We give it plenty of time for the nerve to heal, and then we tested it to make sure that it was working. And then there's the second part of the study where we use the contralateral uninjured side as a stimulus for the repaired nerve. So, as I just said, the main trunks of 7 and 12 were dissected out in a rat, and then we did an acute cut with scissors, and then for most of them, we did an end-to-end anastomosis of 12-to-7. And some of them we did end-to-side. And then after giving ample time for the nerve to recover and the patient to recover, we assessed first spontaneous whisking, and the whisker movement is a proxy of facial movement. And so we look at the movement of the whiskers both when the rat is moving spontaneously in a cage and then also in a more experimental environment with direct stimulation. So we look at branches of the buccal and mandibular nerve, of the facial nerve, and we use bipolar electrodes to deliver pulses to it, and then after that, we use quantification of the whisking. So during the stimulation in our setup, there is high-speed recording of the movement of the whiskers, and there's two ways to collect the data from this. One is a more traditional method where you look at a frame-by-frame analysis of each individual rat, and you put little points on the whisker and then look at where it moves from frame to frame. Dr. Colmar did a really wonderful job of creating a neural network-based markless pose estimation where we're able to basically have the network do the estimation for us of the movements of the whiskers. And also, we developed a bionic stimulation device where the electrical activity in the facial nerve on the uninjured side is recorded and then picked up, and then that impulse is then sent to the injured side, and then we're able to measure the whisker movement after that. So this is actually a photo on the left here of what the facial nerve looks like in a rat. On the right, we have a human. It's actually remarkably similar. So when you're doing your parotid surgery, it's not that different, actually. And this is what it looked like when we were this is basically a branch of the nerve that we then stimulated. You can see there's isolation of the nerve. You can see like the teeth of the rat over there showing you that's like a facial branch. And then the parafilm is set there so that the stimulation is not just being generated and hit on the muscle, that we actually know that we're stimulating the nerve itself. This is what the setup looks like when the rat is undergoing the more experimental analysis. And you can see on the bottom right there that the whisker movements are recorded on video. The rats are under general anesthesia, and then For the first part of the study, we were just seeing if we were able to have whisker movement in response to electrical stimulation. In the second part, when we were using the uninjured side to generate impulses to the injured side, the rats were given canic acid, which is seizure-inducing. So the rats are in status epilepticus, which will then generate spontaneous muscle movements. And we're using literal spontaneous movements of the uninjured side to induce movement on the injured side. And here I have a couple videos. I don't know if I'm able to make it work. Okay, well, I had a couple videos just showing the movements of the face, but it's not that exciting really, but you can see that there is effective movement of the whiskers after the neurotherapy. And then, oh, okay. So then this is what it looks like with the Adopt Deep Cut Lab software. You can see the points on each of the whiskers, and in each frame, a point is put on the whisker, and then this is what it looks like when we generate the data. And this was 4 different whiskers, and you can see the different dots are the different movements of each of the whiskers. So we're able to track them in a frame-by-frame analysis to see the movement. And so getting onto our data here, this is really just a demonstration of our first series where we're seeing if we were actually able to successfully get regeneration of the nerve. And we had 4 rats with end-to-end anastomosis and then 3 with end-to-side. What we saw was that there was no spontaneous movement in the rats. There was variable time in terms of recovery that we gave them. But then what you can see in the column all the way on the right is that all of them were able to have movement due to electrical stimulation. So it gave us hope that we create a bionic device that we would be able to successfully stimulate the nerves and it would actually work. And so for step 2, this is kind of schematic of what it looks like when the rat, I mean, you saw the gross photo of it, but you can see on the left here that there's a detector picking up the nerve activity, goes through an amplifier and then a window discriminator that filters out the noise of the spontaneous activity. Then once it reaches the threshold, it goes to the stimulator that goes to the contralateral side. One thing I didn't mention from the previous slide actually is that the end-to-side anastomosis required a much greater stimulation compared to the end-to-end. And then this is the raw data that we have from the Series 2. And if you look at the top row here, that's the spontaneous activity that you see recording the real-time data from the rat. And each of the spikes is the spontaneous facial nerve activity. And then the next column down is what went through the signal generator, and then we see the next column down that delivers the stimulus to the contralateral facial nerve, and we see that there is simultaneous activity in the injured side relative to the uninjured side here. And so our results demonstrate the feasibility of our proposed approach to explore bionic nerve stimulation. As of right now, there's no device that exists that is able to pick up a patient's uninjured facial nerve and use it as a stimulus for repaired nerve or damaged nerve after tumor or iatrogenic injury. In step 1, we were able to 100% successfully demonstrate that we had functional reinnervation after an injury and then allowing it to heal. And then in step 2, we were able to demonstrate that we're able to restore simultaneous and symmetric whisking after acute injury with an external bionic device. So in the literature, there's actually a lot less than you would expect in people that have tried to create a bionic device for contralateral stimulation. There's some studies that directly record from muscle, some that directly record from the nerve. There's none that actually do a neurotherapy and then have a contralateral side as a stimulus for a recovered side and then record it all at once. In the 1980s, there was a researcher that was trying to do this. They did it a little differently than us, where they did an ansa cervicalis to facial nerve, and then they used the contralateral side as stimulation, and they used strain gauges, which are a much less nuanced way to detect change. So our current project is really modernizing the approach by using real-time analysis with direct movements of the whiskers. And Some limitations is this is just a pilot study. It's obviously a feasibility study, and we're just trying to demonstrate evidence that we can move forward with this. And we have a really small sample size. We don't have histological confirmation of axonal regrowth. Going forward, I think that that's going to be what we do. We're going to look at axonal regrowth in the direct slides of these rats and get a much bigger sample size to see if we can find significant differences in improvement. So in conclusion, this pilot study demonstrates the feasibility of our experimental approach, and applying this innovative approach to a full-scale rat study would lay the foundation for developing a clinically viable neuroprosthetic device for patients that are suffering from facial nerve paralysis. And here's some of my references. And I just want to acknowledge this. Like I said, I'm just like a small person in this. There's been tons of people involved in this over the years, and it's been really fun to be involved in. Thank you.
Last but not least. Any questions? Let's see if we have the microphone. It's coming.
Great to see this, Sean, and it's been a while since I saw an update on this project, but it's really incredible how it's progressed, and kudos to you for sticking with it. I think you said 9 years or 7 years, whatever.
It's been a variety of projects.
A lot of projects, and to Rich Colmar and others, Offer and everybody else who's been involved. So I think it's great work. And what I wanted to comment on is one word in your presentation, the word just. And why do I say that? I got back from a Canadian Society of ENT meeting, and Sanjay Parikh had given a talk about leadership. And he talked about how he was in the car coming from the airport with 2 other people, and he asked who they were, and one said, "I'm just a medical student," and the other said, "Oh, I'm just an ENT resident." And part of his leadership talk was you never use the word just. We're all important. You said this was just a pilot study. It's a pilot study, but it's a very important and very elegant and well-done pilot study. And then you said, "I'm just a small part of this at the end." You're not just a small part. You've been schlepping around with this for countless years and doing all this work. And I think it's just incredible work, so don't downplay it. And I do hope it gets leveraged into some major funding, but, kudos for, great job.
Thank you, Dr. Roosevelt.
Any questions from Zoom?
I think Dr. Coleman.
Yeah, so when Sean says he's just a small part, he actually and Dr. Azulay were the ones who did all the surgeries that you saw on that first slide. And all of Sean's surgeries worked out, and he was the first one to do the end-to-side neurotherapy. So yes, you were more than just.
Thank you, Dr. Coleman.